A compound exercise is an exercise that uses multiple joints and multiple muscle groups. So think about a squat, a deadlift, a pull-up. Those are compound movements. You have multiple joints moving at the same time. Whereas an isolation exercise, which is also called an accessory exercise, targets a specific muscle or smaller muscle group or a specific movement. So think about a shoulder external rotation. You can think of a bicep curl or tricep extension that's targeting one specific muscle or one specific motion of a joint. Go ahead and drop a comment below and let me know how you use isolation exercises in your training. As with anything, you need to look at your goals and your current level of activity to know when it's appropriate and at what point in your workout it's appropriate to use accessory or isolation exercises. Using isolation exercises before a workout can help activate a certain muscle group, improve the mind-muscle connection, get those muscles going so you can then utilize them properly in your training of your compound lifts. It can help with awareness of that muscle. It can help with form for the specific compound exercise because of that activation of those muscles or muscle group. This can be especially helpful if there's any instability or prior injury to that area because it helps get those muscles going and improve the proprioception or awareness of where that joint is in space and all of those factors that can help improve the quality of motion in your compound lifts. It is important to note that you don't want to fatigue the muscle too much before your main lift because then that could compromise form. So there's a fine balance of activating versus fatiguing. And if you're doing it before your lift, you don't want to fatigue it too much. That way you can still get the benefit of that compound exercise. So I often would do this if there's a prior injury to that area, or if there's something that's not quite an injury, but it's like a little nagging something that you're trying to improve how you're moving. I would typically use accessory or isolation exercises before a workout. Something that I always do before I do my salmon ladder is I do activation exercises for my shoulder because it's a very dynamic and very demanding exercise or skill on my shoulders. I always do some sort of external rotation, some sort of like slight plyo, like maybe a little bit of swinging, and I might do some proprioception, like maybe some alphabets or something like that, just to get the shoulder going and make sure those muscles are active before I just go jumping up rungs. You might want to use accessory or isolation exercises after your workout to fatigue that muscle group a little bit more. So maybe you're trying to grow a certain muscle group, maybe adjust an imbalance or something like that. Growing that certain muscle group, you want to fatigue it as well. So maybe you're doing like a hip burner or core burner or a shoulder burner at the end of your workout and using those isolation exercises to really push your body towards failure, because with those compound exercises, it would be a higher risk involved if you were, let's say, squatting with max effort and you're going to a RAR of 0. So you're going to failure. In a squat, if you can't get back up, then the bar falls on you, if you don't have those safeties especially, or if you don't have a spotter. So the risk of injury in an isolation exercise when you're going towards failure is lower. So you can do that as a burner set at the end. This also allows you to get more out of your main lifts because you're not as fatigued. I would say this would be how I would structure a workout if you don't necessarily have a prior injury and you're moving pretty well. This can be still super helpful with training and improving muscle balance and addressing any areas, any smaller muscle groups that you might not be training as well with those compound movements. And this can then reduce your risk of injury, improve muscle balance as you continue your training, and make sure you're training throughout the full range of motion, not only of the exercise, but of the joint itself. Another way of doing things is including the accessory or isolation exercises throughout your full workout. So you might use it as a rest in between or a relative rest to improve the efficiency of your workout. Let's say maybe you're doing a goblet squat in a front hold position, so that's biasing your quads a little bit more, and maybe you pair that with a glute kickback, or maybe an abduction exercise or a side-to-side motion. That can get the lateral hip where your focus is the quads on that main lift, but you're also getting some other stuff with that compound exercise of the squat. But then you can do an isolation exercise, let's say a side-lying abduction. Just for simplicity's sake, you're working the side of the hip only. You can also, if you really wanted to, pair the compound lift with a isolation exercise that targets that same muscle group to really fatigue it more. This would definitely be more of an advanced style of training, and I wouldn't use it super often because you want to allow those muscles to recover before going back and doing that same set. But that will definitely fatigue that muscle out and get more volume on that muscle. I personally like to use this in my own training just to improve the efficiency of the training and get me through the workout a little bit more while allowing me to do more volume in less time. And then this is also how I do my Lift Like Laura programs, where those accessory or isolation exercises are kind of dispersed throughout, where you have maybe a little bit of shoulder prehab, maybe a little bit of hip prehab, maybe a little bit of isolation exercise here, and then maybe some core work there, and then in addition to the compound exercises that you are doing as well. And then sometimes it is also appropriate to do the accessory exercises as your main lift. So this might be if you are injured and you're not able to work a certain body part that is required for some compound exercises. So maybe you have a shoulder injury and you can't hold a weight to squat. That might be a time where you're doing a lot more isolation exercises. And that way you can still stay active, you can still maintain as much strength as you can while you're trying to address the actual issue with a trained medical professional. I also will typically do this in the beginning stages of rehab with my patients, and then we will transition more towards functional or compound exercises to help them be able to reach their goals. That's kind of how I take them through their treatment in the clinic. Although depending on the patient, there is some variations depending on what they need specifically. And then I also have a little bit more accessory exercises or isolation exercises in my prehab programs, because I want them to be specifically addressing any imbalance, working the full range of motion, and that kind of thing. So in my shoulder prehab program, my hip prehab program, and my foot and ankle prehab program, I have a little bit more accessory exercises, but I do also have some more compound exercises as well, just to help tie those into a more functional movement pattern. I did receive this question on accessory versus compound exercises, and it was, what is best for muscle building? And I would really say it's a combination of the two. You can use them in the various ways. So you can use them before your workout, after your workout, in your workout, or as your workout, depending on what you need. And both can be helpful for building strength, because you want to have that balance so you can continue to do those compound exercises, but those compound exercises are really good for progressively overloading things and working multiple joints at once, and those are, again, a little bit more functional. So it's really a combination of both, and at what ratio is going to be dependent on you and your goals. But if you do want a little bit more isolation work, I do have some workouts here that you can follow along with. I have a hip one and a shoulder one that only use bands, depending on what you're looking for, but those are mainly more isolation exercises for you. A front squat, front goblet, blah, blah.